Welcome to today's presentation on the early indicators of heart failure. Imagine if I told you that your body is already sending you urgent alerts at this very moment, signals that could potentially save your life, yet you might be overlooking them. Each year, more than 6 million Americans struggle with heart failure, and sadly, many fail to notice the first warning signs until it's nearly too late. Here's the startling reality. Scientific studies reveal that most people brush off these initial symptoms as part of natural aging, everyday stress, or simply being out of condition. What they don't realize is that their heart is urgently trying to communicate something vital. Today, we'll reveal 13 early warning signs of heart failure that are commonly ignored. Some of these may genuinely surprise you, like a subtle change that happens when you lean forward to tie your shoes, or the unexplained reason why you suddenly wake up at night needing extra pillows. By the conclusion of this video, you'll know precisely what to pay attention to and when it's time to seek medical help. Let's dive straight into these life-saving red flags. Please remember, this video is intended for educational purposes only and should not replace professional medical advice. All the information shared here is backed by verified research. References can be found in the description below. Sign number 1 is shortness of breath during activity. At first glance, many people dismiss this as nothing more than getting older or being out of shape. But when walking to the mailbox or climbing a single flight of stairs suddenly leaves you gasping, that is not normal aging, it's a red flag. This isn't about being winded after a hard workout at the gym. It's the kind of breathlessness that comes with everyday tasks that used to feel effortless. According to the American Heart Association, exertional dyspnea is among the earliest and most common warning signs of heart failure. What's happening inside your body is simple but serious. Your heart is no longer pumping efficiently enough to deliver the oxygen your muscles demand, so your lungs step in to compensate, forcing you to breathe harder. The key difference between ordinary tiredness and heart-related breathlessness is progression. Normal fatigue improves with rest, but when your heart is struggling, you'll notice a steady decline. That short walk you used to enjoy may now require frequent breaks. Carrying groceries or climbing stairs may leave you drained, forcing you to stop and catch your breath. Medical studies show this warning sign can appear months before other obvious symptoms of heart failure. Think of it as your heart's cry for help, a message you can't afford to ignore. Don't chalk it up to being out of shape. Pay attention, because recognizing this subtle shift could save your life. Sign number 2 is orthopnea. This is a symptom that sneaks in so quietly many people fail to notice it's abnormal. It begins with something as simple as needing an extra pillow at night just to breathe more easily. Over time, that one pillow turns into 2, and before long, some people end up sleeping in a recliner because lying flat feels suffocating. Why does this happen? When you lie down, gravity no longer assists your heart in returning blood from the legs and lower body. For a weakened heart, this means blood begins to back up in the pulmonary veins, the vessels that carry blood from your lungs to your heart. As pressure builds, fluid seeps into the lungs, making every breath more difficult. Imagine trying to rest while feeling like your chest is being weighed down. That's what many patients silently endure. According to leading cardiology research, orthopnea is present in nearly 80% of patients diagnosed with heart failure. What makes it particularly dangerous is how gradually it develops. People often explain it away, telling themselves it's just about comfort or a new sleeping habit. But here's the truth. If you've gone from sleeping flat to stacking multiple pillows to needing to sit upright just to catch your breath, your heart is sending you a critical warning. Ignoring it could mean missing one of the earliest and clearest signals of heart trouble. Sign number 3 is paroxysmal nocturnal dyspnea. Imagine being asleep only to wake suddenly gasping for air, as if you're drowning. Your heart pounds, panic surges, and you feel the urgent need to sit up. or even stand just to breathe. This frightening experience is more than a bad dream. It's a serious warning sign of heart failure. Why does this happen? When you lie flat for several hours, fluid that has built up in your legs during the day begins to redistribute throughout your body, including to your lungs. A weakened heart cannot manage this sudden increase in fluid volume. The result is a rise in pressure within the pulmonary veins, the vessels that return blood from your lungs to your heart. As that pressure builds, fluid leaks into your lungs, leaving you breathless and jolting you awake. Clinical studies published in leading cardiology journals reveal that these episodes often occur 2 to 4 hours after falling asleep. For many patients, it is one of the most terrifying experiences of heart failure. Some rush to a window desperately seeking fresh air, while others sit upright until their breathing calms. What makes this symptom so dangerous is how easily it is misinterpreted. People often assume it's due to nightmares, anxiety, or even sleep apnea. While those conditions can disrupt sleep, the distinct pattern of waking up, gasping for breath, especially when it becomes more frequent, should never be ignored. Experts stress that this symptom warrants immediate medical evaluation, as it may be one of the earliest and clearest indicators that your heart is struggling. Sign number 4 is fatigue and reduced exercise tolerance. Among all the early warnings of heart failure, this one is perhaps the easiest to dismiss, yet it can be one of the most telling. We're not talking about the ordinary tiredness that fades with a nap or a good night's sleep. This is a deep, persistent exhaustion that lingers even after adequate rest and turns everyday tasks into uphill battles. Why does this happen? When your heart can no longer pump blood efficiently, your body makes choices. It diverts circulation away from less critical organs and reserves it for vital areas like your heart and brain. While this keeps you alive, it starves your muscles of oxygen-rich blood. The result is profound fatigue and weakness even during routine activities. Medical studies confirm that this symptom can appear months before other obvious signs of heart failure. That makes it critical to pay attention. One of the clearest effects is on exercise tolerance. You may notice that your recovery time after activity becomes dramatically longer. A simple walk that once energized you now demands an extended rest. Carrying groceries, climbing a few stairs, or even showering can feel overwhelming. What's especially concerning is how gradually this decline creeps in. Many people adjust without realizing it, skipping activities, making excuses, or blaming age. But here's the truth. This steady loss of stamina is not normal aging. It is your heart struggling to keep up with your body's most basic needs. Recognizing this change early could make the difference between timely treatment and dangerous delay. Sign number 5 is ankle or leg swelling. Among the most visible early warnings of heart failure is swelling in your ankles, feet, or lower legs. In medical terms, this is called peripheral edema. Unlike the mild puffiness you might notice after sitting too long, this swelling is persistent, progressive, and especially noticeable by the end of the day. Why does it happen? When the heart cannot pump blood effectively, circulation slows. Blood begins to pool in the lower extremities where gravity works against you. On top of this, reduced blood flow to the kidneys causes them to retain sodium and water. Together, these changes force excess fluid out of the blood vessels and into the surrounding tissues, leading to swelling. Research published in leading cardiology journals shows that about 70% of heart failure patients have peripheral edema at the time of diagnosis. It usually starts in the feet and ankles, then gradually extends upward to the calves and even the thighs. You might notice deep indentations on your skin, where socks or shoes press, or find that rings and footwear that once fit comfortably now feel uncomfortably tight, particularly in the evening. The pattern matters. Heart failure-related swelling is typically symmetrical, affecting both legs equally, and tends to worsen as the day goes on due to gravity. One simple check is pressing gently on the swollen area, If the indentation remains for several seconds, that's called pitting edema, a classic warning sign that shouldn't be ignored. Sign number 6 is rapid weight gain from fluid retention. Among all the early red flags of heart failure, this is perhaps the most measurable. We're not talking about slow, gradual weight gain from overeating. This is a sudden jump on the scale that can happen within just a few days, and it should immediately raise concern. According to the American Heart Association, gaining just 2 to 3 pounds in a single day, or 5 pounds or more in a week, is a clear signal to call your healthcare provider without delay. Why? Because a failing heart sets off hormonal changes that tell the kidneys to hold on to salt and water. Every kilogram of extra weight represents roughly 1 liter of excess fluid trapped in your body. Medical studies show this type of fluid-driven weight gain often occurs before other symptoms are noticeable. You may not yet see swelling in your legs or feel short of breath, but the scale provides undeniable evidence. That's why doctors stress the importance of weighing yourself daily if you are at risk for or living with heart failure. It's a simple tool that can serve as an early warning system, helping to prevent hospitalizations. Unlike normal weight fluctuations, fluid-related weight gain from heart failure is steady upward and consistent. It's not a pound lost today and gained back tomorrow. Instead, the increase keeps climbing and is often accompanied by uncomfortable bloating or a constant sense of fullness. Sign number 7 is nocturia, frequent nighttime urination. This symptom often leaves people puzzled. Why do you suddenly need to get up more at night than during the day? Many brush it off as simply aging or blame it on drinking fluids before bed. But in reality, nocturia can be one of the earliest warning signs of heart failure, and it's often overlooked. Here's what happens. During the day while you're upright and moving around, gravity pulls fluid down into your legs and feet. A weakened heart struggles to pump that fluid back to the kidneys for processing. But when you lie down at night, gravity shifts the fluid back into circulation. Suddenly, your kidneys are flooded with extra fluid and forced to work overtime, producing more urine than usual. According to research published in major cardiology journals, nocturia frequently shows up before other hallmark symptoms like swelling or shortness of breath. That makes it an important red flag to notice early. Patients often describe waking up 3 to 4 times each night to urinate, with each trip producing larger amounts than expected. This isn't just an inconvenience, it reflects your heart's reduced ability to manage normal fluid balance throughout the day. So if you find yourself repeatedly waking at night, ask yourself, could this be more than age or habit? For many, it's the heart's subtle cry for help, a message that deserves attention before the problem becomes more serious. Sign number 8 is a night cough or wheeze when lying down. A cough that shows up mostly at night may seem harmless, but it can actually be a subtle yet serious warning sign of heart failure. This isn't the productive cough that comes with a cold, and it isn't the dry irritation caused by allergies. Instead, patients often describe it as a persistent, nagging, dry cough that interrupts their sleep, yet seems to ease when they sit upright. Why does this happen? The explanation is the same mechanism behind orthopnea. When you lie flat, the fluid that is built up in your body during the day shifts and redistributes. Some of that fluid seeps into your lungs, creating mild congestion. In response, your body tries to clear what it senses as an obstruction by triggering a cough. Medical literature notes that this type of nocturnal cough often worsens in the early morning hours and may sometimes be accompanied by a faint wheeze. Patients frequently report little or no sputum, or occasionally coughing up frothy mucus with a white or pink tinge, clear evidence that fluid has entered the lungs. What makes this symptom especially deceptive is how easily it can be mistaken for something else. Many people attribute it to seasonal allergies, post-nasal drip, or even poor sleeping conditions. But when the cough follows a consistent pattern, appearing mainly at night, improving when upright, and becoming more frequent, it deserves immediate medical attention. Sign number 9 is palpitations or an irregular pulse. Your heart's rhythm is more than just a beat. It's a vital signal that can offer some of the earliest warnings of heart failure. Palpitations, that unsettling sensation of your heart fluttering, pounding, or skipping beats, often appear in the early stages of the disease when the heart is working overtime to pump blood effectively. As the heart muscle weakens, it can begin to develop irregular rhythms while struggling to keep circulation steady. You might notice your heart racing even while you're at rest, or feel as though it skips a beat without warning. Some describe it vividly, like their heart is flipping or doing somersaults inside the chest. According to research from leading cardiology centers, cardiac arrhythmias, especially atrial fibrillation, are both a cause and a consequence of heart failure. The connection works in both directions. Irregular rhythms can strain the heart until it fails, and heart failure itself can trigger dangerous rhythm disturbances. Left unchecked, this cycle can escalate quickly, putting patients at serious risk. Palpitations tied to heart failure are often most noticeable when you're lying down or trying to rest, and they may come with a wave of anxiety or an uneasy sense that something is wrong. While it's true that palpitations can stem from many conditions, including stress, caffeine, or even thyroid problems, when they occur alongside other symptoms of heart failure, they take on far greater importance. The American Heart Association emphasizes that palpitations in the context of heart disease should never be dismissed. If your heartbeat feels irregular, erratic, or different than usual, especially when combined with fatigue, shortness of breath, or swelling, it's a clear sign to seek medical evaluation right away. Paying attention to this signal could be the difference between early intervention and a dangerous delay. Recognizing palpitations as more than a passing sensation may be the key to protecting your heart's health and your future well-being. Sign number 10 is dizziness or near-fainting episodes. These unsettling experiences, feeling lightheaded, unsteady, or on the verge of passing out, can be early red flags of heart failure. Why? Because when the heart weakens, it struggles to pump enough blood to maintain steady circulation to the brain, especially during sudden position changes or moments of exertion. Normally, when you stand up quickly or increase activity, your body compensates by raising heart rate and tightening blood vessels to stabilize blood pressure. But in heart failure, this adjustment doesn't happen effectively. The result is a brief but significant drop in blood flow to the brain, leaving you dizzy, lightheaded, or in severe cases, fainting altogether. Clinical research shows that syncope, medical terminology for fainting, occurs in about 20% of heart failure patients. In fact, studies highlight that these episodes sometimes emerge before more obvious symptoms appear. Triggers can be simple, standing for long periods, moving suddenly, or even mild exertion that once felt easy. What makes this sign particularly dangerous is how often it's dismissed. Many people chalk it up to dehydration, side effects of medication, or inner ear problems. While those causes are real, when dizziness or fainting occurs alongside other symptoms like shortness of breath, swelling, or fatigue, it points to something far more serious, a significant reduction in cardiac output. The takeaway is clear: don't ignore these episodes. They are your body's urgent signal that your heart may be struggling to keep your brain supplied with the blood and oxygen it needs. Sign number 11 is abdominal bloating, poor appetite, or early fullness. At first, digestive issues may not seem connected to your heart. But when bloating lingers, when your appetite fades, or when you feel uncomfortably full after only a few bites, these can actually be early signs of heart failure. Why does this happen? Because heart failure doesn't just affect the heart. It disrupts your entire circulatory system, including blood flow to the digestive organs. When the heart struggles to pump efficiently, circulation to the gastrointestinal tract slows down. On top of that, fluid can build up inside the abdomen, and the liver can become congested with blood that isn't being moved effectively. The result is a chain reaction of digestive problems that can make even everyday meals difficult. Medical research highlights that these gastrointestinal symptoms are often overlooked, both by patients and healthcare providers, simply because they don't look like heart problems. But the connection is real. Many patients describe feeling stuffed after just a few mouthfuls, experiencing ongoing nausea, or noticing a persistent bloated sensation that doesn't improve with common digestive remedies. Liver congestion from heart failure can also trigger pain or discomfort in the upper right side of the abdomen. Some patients explain it as a constant pressure or heaviness in the belly, making eating not just unpleasant, but nearly impossible. The key is awareness. If digestive changes like these appear, especially alongside other warning signs, don't dismiss them as minor stomach troubles. They may be your heart sending an early critical message. Sign number 12 is bendopnea, shortness of breath when bending forward. It's a symptom so unusual that most people have never even heard of it. Yet doctors now recognize it as one of the most specific early warnings of heart failure. Bendopnea refers to the sudden onset of breathlessness that happens within just 30 seconds of leaning forward, whether you're tying your shoes, picking something up off the floor, or leaning over a sink. First described in medical literature in 2014, bendopnea quickly stood out as a remarkably precise marker of elevated heart pressures. Why does it happen? When you bend forward, the pressure in your abdomen rises. This pushes upward against the diaphragm and increases pressure inside your chest cavity. For a heart that's already struggling with elevated filling pressures, that extra stress can overwhelm the system almost instantly, leaving you short of breath. Research published in leading cardiology journals confirms that bendopnea is present in roughly 30% of patients diagnosed with heart failure. Even more concerning, it's strongly linked to advanced disease and a higher risk of mortality. In fact, the reliability of this symptom is so strong that cardiologists now view it as a non-invasive way to assess heart pressure without specialized testing. What makes bendopnea stand apart is its specificity. Unlike fatigue or swelling symptoms that can come from many conditions, healthy individuals almost never experience this type of breathlessness when bending forward. That's why noticing this pattern should never be dismissed. If you find yourself struggling for air simply by leaning down, it may be your heart sending one of its clearest and most urgent warnings. Sign number 13 is cold hands or feet, or a narrow pulse pressure. This final warning sign reveals itself in your circulation, often first noticed in your extremities. Have you ever wondered why your hands and feet feel icy cold even in warm weather? It may be more than just poor circulation. It can signal that your heart isn't pumping forcefully enough to keep blood moving properly. When heart failure develops, the body goes into survival mode. It directs blood to critical organs like the brain and heart, cutting back flow to your hands and feet. The result? Persistently cold extremities, sometimes with a bluish tinge to your fingernails or lips. You might touch your hands and notice they're cold, despite feeling warm overall, or realize it takes much longer than usual for your fingers and toes to warm back up. Another sign is narrow pulse pressure, something you won't feel on your own, but can be detected with blood pressure readings. Normally, the gap between systolic and diastolic pressure should be at least 40 millimeters. When that gap narrows significantly, it suggests reduced stroke volume. Your heart simply isn't ejecting enough blood with each beat. According to research published in major cardiology journals, these changes in circulation often appear gradually, but they can be early indicators of declining cardiac output. That's why paying attention to these subtle shifts matters. They may be your heart's quiet but urgent plea for help. If you've recognized yourself in any of these 13 warning signs, don't panic, but don't dismiss them either. Heart failure, when identified early, is a condition that can be managed. The key is awareness, learning to notice the subtle signals your body is sending and taking action before it escalates into a medical emergency. What's important to remember is that these symptoms often develop slowly, almost silently, and are easy to overlook. You might tell yourself it's just aging stress or being out of shape. But when several symptoms show up together, or when everyday activities suddenly become harder than they used to be, your heart may be sending you a critical message that shouldn't be ignored. Medical research is clear early detection and treatment of heart failure can greatly improve both your quality of life and your longevity. Today's medicine offers powerful tools from medications proven to strengthen the heart to lifestyle changes that can slow down, or in some cases even reverse the progression of the disease. If this video has been helpful, type the word helpful in the comments. It truly motivates us to keep creating life-saving content like this. And remember to like, share, and subscribe so you don't miss important health information that could protect you and your loved ones. Thank you for taking charge of your heart.